The Behavior Analysis Regulatory Board will now exit executive session and reconvene open session at 10:46 a.m. No final decisions were made and no votes were taken in the executive session. The public will be moved back from the breakout room and representatives of the media may once again report all board discussions and actions.
Perfect. Thank you. All right. Next item on the topic is policy, and I will get out of the way and let Ann in here.
Good morning, everybody. For the record, my name is Ann Thompson, and I'm the policy analyst here at HLO, and I help the Behavior Analysis Regulatory Board. Everybody okay? Everybody can hear me? Okay. So the thing that I wanted to discuss with you today, House Bill 2421 passed in 2023. I included that in your packet, and it required the board to establish interventionist professional methods and procedures. The bill was silent on when it had to happen, but we want to be expedient. We want to do this as quickly, I don't want to say as quickly as possible, but thoroughly and with speed in mind, because the legislature wants this done. So part of what I did, I asked the board for any feedback, any documents, anything like that, that would help us with this bill. And Megan Johns sent me a document that had been prepared. It's in your packet, and I believe it had been prepared by BARB. Is that correct, Megan? Megan?
Yes.
Okay.
Yeah,
so this
sorry.
was prepared.
Yes, it was prepared by BARB.
Yeah, by BARB. It's an extensive document, and it actually takes the BACB registered behavior technician, the RBT, and goes side by side. One of the issues I had with this is enforceability. Again, there's a lot of lofty language. There's a lot of, fostering integrity within the workplace. And while that sounds great, as regulators, we look at it and say, what can we enforce? Somebody makes a complaint and says that a technician or we call them interventionists, failed to foster integrity within the workplace. Well, what would that look like? What would the investigations look like? And also, when I was reading through this, again, holding themselves to a high standard of professionalism. Well, it sounds good, but what does that look like on an investigation? What would that take? How would you mark that? And as I went through this, time and time again, I came up against the fact that it's not that different from the BACB document, which my history with that organization is that's going to cause a problem. They're going to have an issue with that. You can't just paraphrase something and then there's so much in this that from an enforcement standpoint would be really difficult. So I appreciate this document. It was the only one I got. And with that in mind, I spoke to our regulatory department. I did some research into what other states have done. And most states don't have codes of conduct or lofty standards for people working at this level. They just don't. They don't go there. They might be covered under a blanket policy, don't steal, don't, do anything like that. But as far as the lofty language and upholds the highest moral character, no, they don't get into that at all. In fact, some states are actually moving away from regulating. So what I did in lieu of a giant document that, to be fair, also you're dealing with frontline text, right? Asking them to read, memorize, and integrate a large code might be problematic also. So what I did was I talked to our regulators, I looked at other states and looked at the complaints we get, the issues that people have with interventionists. And I came up with a list of 8 things, very simple language, very clear, easy to follow, that I've included in your materials. Obviously, 824 is your rule chapter number. I don't know if you decide to go in this direction, what number that would end up being, because I have to tuck it in somewhere. But essentially, what I said was, in addition to the unprofessional conduct requirements in 676, 612, and that's our statutory unprofessional conduct that has a lot of basic behavior in it, and 331020075, and that's an HLO rule that we put together by finding loopholes, or sometimes complaints find loopholes in some of 676, 612. So that's a catch-all category that we've added behaviors to, don't defraud your clients, this kind of thing. So in addition to that, I came up with 8 things that were recurring themes with our regulatory department, and it seems across the board. And very, very simple, very enforceable, only perform duties in which the interventionists are competent as determined by the supervisor. They don't get to decide if they are competent or not. They have to follow the behavior plans as directed by a supervisor, gather and report data accurately. That was a big one. Protect client confidentiality, report time worked with clients accurately. That was a big one. Putting in for hours you didn't provide services, you made an appointment, you didn't show up, but you billed for it anyway. Follow through on work commitments. Same thing, right? Not accept gifts from clients, because apparently bartering, this kind of thing gets professionals in this space into some bad areas that apparently that's a big issue. And not engage in romantic or sexual relationships with current clients or supervisors. I read some requirements from other states that, mainly for behavior analysts, that they can't have a romantic relationship with an interventionist or a technician for 2 years after the last time they've been supervised, or 5 years or whatever. And I thought that just seems to be difficult to enforce. So I just went with this and wanted to see what you guys thought. I just thought I'd throw it out there. I don't have all the answers, but this is what I came up with, a simple, enforceable, and seemed appropriate for this kind of worker providing this kind of service. But I'm curious to see what you think.
This is Brenna. I really like it. I think that's great. Like I wonder about follow through on work commitments, and I'd maybe like to see something about, I mean, if you're punishing a kid, like you should wonder a little bit of, client protection in terms of the restraint and seclusion kind of things we've been talking about in other contexts. But I think this approach makes a ton of sense.
I'm a little, we already have a policy on restraints.
Okay.
And so what I would wonder is, how would restraints, I hear what you're saying. I appreciate it. It says follow through on work commitments. And then you mentioned restraints. How would those things work together?
Sorry, I spoke too fast and smudged my thoughts together.
No, that's
So
okay.
I'm not sure that follow through on work commitments is clear enough to be a rule. Like I'm
okay.
Per the same concerns that you've been talking about.
Do you want to strike it? I mean, we could strike it.
Maybe.
What do you, Marie? Sorry, Brenna. Marie?
Yeah, this is McMahon. I think I'm interpreting when you say follow through on work commitments, that would regard, I guess, whatever the commitment was for, scheduling or time, the services you're providing.
Got it.
That seems like a good rule to me, but based on the confusion we're having right now, I'm wondering if maybe it needs to be worded differently. I don't know.
Okay, great.
Yeah,
that's what I was trying to get at, was a lot of people were like, it's so important. If you say you're going to be at this client's house at this time, show up on time, be ready to work, be prepared. If you say you're going to be there, be there.
Right.
Don't show up or skip or not, no show, no call, or, oh, I quit this morning, that kind of thing. So if that, because that seemed to be a prevailing theme that I came up against.
Yeah, that makes a ton of sense.
What would be, I mean, you guys are the experts, right? What are some, do you want to keep it, or the idea of it? And B, I mean, obviously this is going to have to go through a rules advisory committee, and this is going to have to go through a lot of steps, but are there some better words that we can get at that issue that 6 is trying to get to?
This is Parnam. I think, and I can only speak for me, but us as behavior analysts are always going to struggle with really simple things. I like it. I actually really like it. But asking us to define anything easily is sort of a task, because we want to operationally define everything.
Sure.
So I'm trying to think through like professional commitments. Like I want to give examples and non-examples,
Okay.
but that just gets into being more complicated.
Maybe just follow through on work commitments, semicolon, i.e. be punctual,
work.
be prepared.
Right. Show up where you're supposed to, when you're supposed to, and don't quit with no notice because there's tiny humans involved.
Yeah.
Right. And that was the other thing, was I had an appointment. I see your hands up, Megan. I had an appointment at 10, but my hair wasn't working, and so I quit. All right.
Yeah.
And I'm sure you guys are kind of laughing ruefully, but I mean, I was seeing stuff like that.
Oh, it happens.
So
yeah, no, it happens.
Right. Megan, what are your thoughts?
I agree. I wonder if wording it with follow through with committed scheduled work sessions or day, like something like that, where it's like sessions. Usually we refer to things as like sessions. So I wonder if maybe that might be just some language to help.
Okay. Okay. Let's see. Punctual. Help me out, you guys. Words. You should say something like meet, scheduling, appointment, expectations, or
arriving to scheduled appointments in a timely manner.
arriving.
Showing up at your scheduled times, prepared.
Okay. Arriving to schedule. Do you call them sessions, not appointments? Arrive to schedule.
Yeah.
Okay, so arrive to scheduled sessions on time, or give appropriate notice, something like, I hate the word appropriate, because then it's like, okay, what's appropriate? But what would be the quick and dirty way to get at this? Arrive to scheduled sessions on time.
So what if we say, because I'm thinking for like my company, we have specific call out rules. Like we get it, you might have to call out the day off, but you have to call in at least, I want to say I think it's 3 hours before your scheduled shift. So it makes appropriate a little less vague. I don't know the enforceability of something, because there's always going to be emergencies, right?
Well, is that something we need to keep? If we say report time worked with clients accurately, does that in a sideways get to where we want to go?
Well, this is McMahon, and I would say that they're two separate issues. And one is documentation, the other is just, being a good worker.
Showing up to work.
Being responsible. So
yeah, I agree.
I think you need both of them.
Okay.
Yeah, because I think like reporting the time you worked is important, but also you have to be at work. Like you can't just not show up to a tiny human's appointment, right? So like you could still accurately report that you didn't go, and them still not okay with it.
Yeah. Somehow show up doesn't seem big enough, but
Yeah.
also, yeah, right. But
Do more than just be present.
Well, right. I mean, we're getting it. I mean, there's the actual body, and then there's the providing quality services, which is another thing. But we're trying to make this as simple as possible. And also professional methods and procedures. That's the other thing. I actually looked up the definition of it to make sure that all my ideas met that, because that's what we're supposed to do and only what we're supposed to do, right? So it can't be aspirational. It has to be, professional methods and procedures. This is a ritual. This is a way of doing things. So if we say follow scheduling policies from employer or supervisor, follow supervisor's scheduling policies, would that get us there?
Yeah.
Yeah, this is Jenny White. I like that much better because just every place is going to have different policies and procedures. Like, for instance, I work for public schools and we have a union that our RBTs are represented under, and they have very specific policies and procedures. So I think something like that would be good.
So something like follow, and this is what I have. I crossed out 6 and I wrote follow supervisor's scheduling policies. Does that get us to where you need to go, when you need to go, and if you have to call out, what you do, but you don't just get to decide that you're not feeling it and don't go one day? Because that seems enforceable. You had a schedule, you've got a policy. If we get a complaint on an individual, we can ask for their schedule, their supervisor's policies, and it would be easy to say, okay, you were supposed to be there at 10 and you didn't show, you didn't call, we have records, and then we could say, okay, very specifically 824, whatever the number is going to be, subsection 6, you violated it. Simple. Are we okay with that?
Yeah.
This is Jenny White.
So.
That sounds good, but could we, instead of saying supervisor's policy, could we either add organizations policies, like supervisor or organization policies, or just organization? Because like my personal policy on being late or something might not be what my organization's policy is. Like, mine might be stricter than my organization, but ultimately my organization's the policy they would have to follow.
What if you're in a private practice? Yeah, I'm just trying to say, okay, what if you're not part of a big company? And also, what do we say if your supervisor's requirements are different than your organization? What's the RBT to look at? Or the, interventionists, if you've got 2 different policies. And again, think about enforcement. If we get a complaint and they say, okay, well, I followed my organization's policies, but my supervisor has something different, I didn't know what to do. Again, I'm just devil's advocate. I'm just coming at it from the regulatory side. So what would that look like? Yes.
This is Heather. What about if you said be professional, including being punctual, attending scheduled work sessions, providing timely notice of absence, but having the be professional at the beginning and then giving some examples?
I have concerns with the word professional just because it's used in all kinds of ways to sort of, perpetuate stereotypes and things. I think the spirit of it makes sense, but it's almost like to define professional, we'd be getting into really wordy behavior analyst things again, And like, I'm speaking as someone who is covered in tattoos, and I've been written up for not looking professional. And I'm like, how does one look professional? Or like hair policies that I can think of that people have had where people of color have not been able to have natural hair because they were told it's not professional. Like, that word, I think, maybe has a lot that comes with it.
Okay, well, what about the spirit of what Heather said, which was, how about be punctual to scheduled sessions?
Yeah.
I mean, we can just say be punctual to scheduled sessions. We get the on-time aspect. We get the showing up where you're supposed to be. And And then if you want, we could add a separate section about scheduling if you feel it's necessary. Again, you tell me. I'm just kind of guessing here.
I guess is the problem that like tech's not showing up to appointments on time, or is it more of a problem that people just have a bad hair day and quit? Or are they both big problems?
Well, I look to our professionals here, but not to use the word in a derogatory way, but you guys are in the business. When I was looking up complaints in other states, when I was looking at what issues people have that would fall under professional methods and procedures. Again, methods and procedures. We have to avoid the lofty language. We can't get into uphold the highest community standards, you know, whatever. So I tried to get at this idea of if you're supposed to be somewhere, you know, on time and ready to work. And that fit into the definition of professional methods and professional procedures, essentially. Without straying too far afield, I tried to stick to the exact language of the bill and still get at that issue that I saw many people refer to, which is these are frontline workers, you know. Megan.
This is Megan. I was just thinking, I mean, I think other than just be professional, the other part that was mentioned earlier about arriving to scheduled sessions or being prompt and then making, I can't remember the wording she exactly used, but making accommodations if it can't be met. I feel like that encompasses probably those two things, right? Even if somebody was going to do a last minute quit, they would still have to make an accommodation for that scheduled session. In my
Thoughts? So be punctual to scheduled sessions or work with your supervisor. Yeah, I'm again, that's the other thing is we also like very short, sweet sentences because you don't want to have to send a notice of intent and say, okay, the first 4 words in this, you know, we like things that are very separate. So we could say, hey, 824 number section 5. This is what we think you violated. So having these long, compound, complex sentences from a regulatory standpoint can get a little difficult. It's always better to have things broken out into very simple, almost staccato, you know, very simple bullet points, easy to understand. So if we had be punctual to scheduled sessions, and again, this is going to go, you know, if you want to go this way, this would be subject to a rack. This would, you know, go out to public comment. But does be punctual to scheduled sessions kind of get us closer to what we want with this issue?
This is McMahon. That I would defer to my colleagues that are BCBAs, but it seems like it does get closer to that, you know, be punctual. That's the idea of, you know, showing up to your sessions. I think that sounds like you've done some good research regarding this as an issue that, yep, it just sort of shows you have to put things like, you know, show up in a plan because it comes up often enough as a complaint. So it seems like it does need to be in there. And I agree with having shorter wording.
Yeah, it's just really hard. I mean, I've done this with another board that was working on practice standards, and they were looking at national standards that were 3 paragraphs long with no punctuation. And I said, well, how on earth can we say you violated the third semicolon section of, you know, and I'm sure any attorneys present would know that once a comma can change everything, right? A semicolon can change everything. A comma and then the word or can change everything. So again, you're talking about the audience, you're talking about who we're trying to get at and the problems that we've been seeing and other states have been seeing. So if you think that this kind of, for the most part, gets us close. Is there anything I need to add? Did I miss something? And we might hear from
And
the
this
RAC.
is Brenna.
Yeah.
I really like the approach. I mean, I do rant at younger lawyers that, when we're wordy and no one knows what the hell we're saying, we can't wonder why nobody follows our advice. So to the point of like the public understanding what they have a right to expect and for frontline people to understand what they're to do. Like, I think this makes a ton of sense. I really appreciate the approach.
Thank you, Brenna. Again, keep it simple, keep it clear. Most people want to do the right thing, but if they can't understand it, and I think that's where government gets in a lot of trouble is we do these government ease, even press releases where people's eyes glaze over after the first two sentences and they're like, I don't know. If you're expecting frontline technicians who don't have doctoral degrees to stay out of trouble, what's the quickest way we can get there? So if you think this works, as part of the discussion, we could kind of get into next steps. If you want to proceed with this, and it sounds like you do, the next step would be talking about sending this out in front of a rules advisory committee. And part of the new requirements for rules advisory committees, back when you guys gave me stakeholders, like we can't say individual people, but we want to talk about stakeholder groups that you would like to see represented on the RAC. And House Bill 2993 from a couple of sessions ago made some changes to what stakeholders need to be considered. You can't just say, okay, here's a rule, a proposed rule or draft. We'll talk about the people that have to put the rule into effect. We'll talk to service providers, we'll talk to service recipients, we'll talk to insurance companies, and we're good. The new requirement from 2993 is not only do we have to, in all rulemaking, have a racial equity statement, and that's what the Rules Advisory Committee will help with, how this rule will help to close racial gaps, equity gaps. Also, you have to think about stakeholders that might be impacted from the rule. By the rule. So not just somebody who will, a BCBA or an interventionist, but somebody who might be impacted by this rule. And I bring this up so that if we talk about what stakeholder groups that you'd want us to send invitations to, not individuals, but groups, I just kind of wanted to get you thinking a little more broadly than we have in the past. It was, you always want to have, service provider, service recipient, but then expand your mind a little bit. Who could possibly be impacted by this? An interventionist, parent, well, obviously parent, maybe an organizational manager, something like that. So anyway, if I could kind of get you thinking and stewing on that, I'm all ears. Well, just to get you going, I would assume you'd want to have maybe a provider like a BCBA or a BCABA. Would that be appropriate?
Mrs. White, I think that's definitely appropriate.
Okay. Do you think maybe a registered interventionist? Or would they, do you not think that they would have, what do you think? Who should be around the table discussing this and saying, we don't like it, we'd rather have this, what about that?
I can think of interventionists that would be valuable contributors to that conversation. I think that makes sense.
Thank you.
This is Megan, and ORABA has a student analysts, so people that are in the BT positions, but are maybe looking at continuing into a higher role later on. And that type of people might be a good option where they're currently sitting in that, but they're also looking at excelling the field.
Okay, maybe I'm not understanding. Are you saying there's somebody serving in a role in a REBA and you think that person should be there, or?
They have their own kind of like a student ambassador group. Like they like, yeah. So those type of people, I don't know if that group in particular, but they might be able to like facilitate something as well in terms of like getting BTs that might be interested in looking into that a little bit more.
Okay, so a student ambassador group from Maraba, one of those members?
Yeah.
Okay. Okay. Who else? About a parent? What do you think, Brian? Do you
Yeah,
think
I do. I think a parent would be good. And then I've also, this is a little tangential, right? But I've been thinking about parents who might take my spot on the BARB and anybody who might be willing to do it. And I have a couple of ideas. So yeah, I think a parent would be good.
Okay, so a parent. So right now we have like a BCBA, a registered intervention. Do you want an interventionist that's registered in Oregon? Or could it be somebody who has an RBT that isn't an interventionist, or do you want somebody who's registered?
This is White. I would think somebody who's registered in Oregon.
Okay, very good. I have the student ambassador group, a member of that from Araba, and a parent.
This is White. Feel free to shoot this down, but wonder if another consideration, like thinking about who will this impact like in the future, perhaps. We do have several school systems in the state of Oregon who are hiring behavior interventionists. I don't know if like a representative from the school system might also be someone to consider.
Just as a point of clarity, that's a great idea. It's my understanding that the school systems have their own requirements for interventionists. Do you know if they, because I don't know much about the school system, maybe Brenna, you might know, do they require their technicians to be registered with us? Do they have separate requirements? Because I looked and it looked like behavior analysis in schools. Some of them were using those QMHP folks and some things like that. And I'm just wondering about their sphere of influence. Do they have like their own requirements separate from us? Would that cause some confusion or helpful?
This is White. So I can only speak to the school system I work for, but the people we hire under our BCBAs or supervised by our BCBAs, we actually have RBTs, which is a whole nother thing. But I wonder if in the future, that I don't know if this would happen in the future or not, but I wonder if in the future we might look at like trying to encourage school systems to hire RBAIs or to be sure that they're licensed under RBAI or as RBAIs, like as an additional protection, just having that state licensure. I know like our school system, for example, is looking at, is there a way to bill for these interventionists and BCBAs within the school system? None of this is happening now, but it's just considerations for the future. And so like our behavior technicians that work for us, some of them are RBAIs, some of them are just RBTs. And they do have to follow their, that's what we're always telling the school administration anyway, is like, we have to follow our ethics code, our professional requirements, those sort of things.
Okay.
This is Brenna.
Yeah.
Like, so there's, I mean, further on to what Jenny's saying, right? Like, you know, the ABA in school in Oregon has, you know, kind of a contentious origin, right?
Yeah.
And we've had, you know, hard conversations with school districts over the years about, to Jenny's point, that like they can't really do to the BCBAs what they do to the school psychologists, which is give them caseloads of 5,000 kids and go, well, how you deal with this is your problem. Like there are only so many kids they can stack on top of BCBA until the BCBA can't comply with the ethics code. And this hasn't really been a welcome conversation. And I kind of feel like we're coming around. The school districts are starting to understand that, you know, that they can kind of, you know, operate within the sort of BCBA, you know, framework, and the sky won't fall. But, you know, every once in a while we have a fight at the Oregon legislature level about whether schools need to be bound by any of these regulations, and the school's position is always, no, we don't. So I think it might be constructive to invite, but I don't know if they're going to participate or not.
My only concern would be if they hire RBTs, if they are not required to use interventionists, then if the RBTs are not registered with us, we have no authority over them.
Yeah,
So,
and that is their position.
well, and it,
I mean,
you know,
generally speaking.
Right. Well, and I'm a big proponent of not wasting people's time, and I just want to make sure that if we're going into that space, because Brenna, yes, I know it's very contentious. If we're going into that space, why would we be? What are we hoping to get, Jennifer, out of the conversation? Now, remember that we can't promote the profession, we can't push to influence or anything. That would be the role of ARABA, or if they want to bring the schools on board with our requirements, that would be a legislative change. But so I just want to make sure if I contact somebody, I know what we're trying to get, because if you don't know, then you don't know if you got it, right? So what would we be hoping to get out of the conversation with the schools? If I reached out to, I don't know if I'd reach out to the Department of Education or some school district, I don't know. What would I be reaching out for? Like, we want you to come and weigh in on these rules for interventionists because why?
This is why I was just thinking, and as far as the future, just thinking about who this will impact in the future and wondering if, you know, years down the road, we're going to see more and more. I mean, when we hire our interventionists, like the job hiring for is RBT, which I've argued about, just saying that like we should accept an RBT or an RBAI credential, which they actually do. But anyway, that's a whole different thing. But just saying that like school districts are hiring these technicians, whether they're nationally credentialed or state licensed, and that might be something in the future, that like these rules are things that are going to impact them. But I'm also totally okay if, you know, we don't include also.
Oh no, there's no wrong answer here. I'm just trying to, when I ask these questions, I like to understand like what space that they occupy in this ecosystem, because it's always changing. It's a young-ish profession, and it's changing very, very quickly. And so if there's something going on over there that I don't know about, I want to know, right? So I'm glad that you brought that up. Is there a particular, because again, I don't know anything about the school systems. Is there a way that where I should send a letter to Brenna or Jennifer? Do you know if I was to go into that space to invite somebody to apply for a RAC, where would I even send a letter? Is it Department of Education, school district? Who would it go to?
This is why, I mean, it could be a BCBA who works at a school system who's like directly dealing with these things. You could also consider, I think, like an administrator, the people who are making the decisions about including, you know, these positions on their budget. So I think those would be a couple of different areas, different ways to go. There are several school systems that already have RBTs for hire, or considering our RBTs, behavior technicians, sorry, behavior interventionists for hire that already have those positions. So I could always send you lists of ones that I know of anyway, and I'm sure the rest of, like, I know probably Megan and Brenna might be aware of others as well.
Yeah, if you guys could send me, because I don't have any kids, I don't know how the school system works, where I would send a letter, because, I think sometimes, and I've talked to other, rules coordinators and analysts, that they just sort of send letters into the ether and wonder why nothing comes back. Is there a specific, like, at this level, you would want to address a letter to, I don't know, the HR representative at Portland Public Schools? Or, can you give me a target? Because I wouldn't even know where to begin to reach this audience.
You would want to reach out, I think, to an administrator at a specific school district. Like, I don't think the Department of Education is going to know what the hell to do with that kind of request.
So a school district?
Yeah, I think so.
A school district, another consideration could be like, for example, several school districts in this area use an organization called Columbia Regional for support and training, and Columbia Regional actually has like an applied behavior analysis group. And so the person who leads that could be another good contact as well, as they're dealing with several districts and several administrators and things.
Columbia Regional?
Yeah, I can send you the contact there would be, Brad Hendershot would know a lot about it, actually, because he's the supervisor over the person who runs that group. But then the person who runs that group directly, her name is Hillary Flood, and she's a BCBA.
Hillary, what's the last name?
Flood, Flood.
Now we want to try to, I appreciate that. So right now I can reach out to BCBAs, registered interventionists, the student ambassador group at Araba, a parent, and Brenna as our parent contact. How would I get one of those? Could I reach out through like Autism Speaks, or is there a support group or something?
I would suggest that you reach out to Toby Rates, who's the executive director of the Oregon Autism Society. And Autism Speaks is a kind of difficult organization these days, but Toby,
yeah, I know Toby.
So Toby can, and she can help in two ways. First of all, she'll have a sense of any interested parents, and I'll ping Susan Rogers, a mom that I know who I think has got some time, and I've been kind of hoping to talk into replacing me. But then Toby also, like, if there's any interest in including, adult autistic self-advocates, Toby's the best way, I think, to kind of contact that community as well.
Okay. I have a school BCBA or administrator of a school district, and I can contact Columbia Regional. Brad Hendershot and Hillary Flood are contacts there. Seems like a good place to start.
I think that's a good place to start.
I may have missed it. Did we say if we can get an autistic adult to be on the rack as well? And I think I heard you mention it, Brenna, but then I wasn't sure.
I know there's a lot of feelings around this, but I think it's a good idea to include adult self-advocates whenever possible. And I think Toby would have good thoughts about who might be interested.
Okay, I'll have to check the statute, because I know the point of this board and the point of the licensing and registration was people who work with autistic children. And I have to see if that word, if I remember it correctly, because that might, if we have an autistic adult, I'm trying to see how they would fit into the authorities on this, but I'll have to think about that.
Yeah, I need to think about it. And I mean, a lot of the autistic adults have had, negative experiences with ABA. The profession's changed over time. And so it can be difficult to kind of include those voices in what we do, but I think it's important.
Okay, yeah, I know.
But I
the
hear
last
you.
leg-
I do
last-
hear you about, what you got to do. I
Oh,
get it.
no, and I totally appreciate it. And it's one of those things where sometimes a great idea has to be kind of dialed back because of the lane that we're in. We have
Yep.
to. I want to make sure we stay very focused. And it's interesting that you mentioned that. I mentioned at the last meeting, the last legislative session, there was something to do with, gosh, I think it might have even been the bill that went through creating the provisional registration, and one of the senators was a no because she had been getting feedback from the developmentally disabled community that ABA was abusive, and she didn't want to expand anything having to do with ABA, and it was just interesting. So, okay, well,
that voice is out there, and there's a basis for it. But I think it's important that we move forward as a community, acknowledging those perspectives and engaging them constructively.
Agreed.
Now I'll stop talking.
Agreed.
No, Brenna, please don't stop talking. If you stop talking, this is why you're here. This is why you're here. I mean, we don't all have to agree on anything, but it's not the point. I mean, good rules, and I'll say this again, I know I drive people crazy. Good rules don't make anybody happy because everyone had to compromise. If anyone walks out of rulemaking going, pumping their fist and going, yeah, then we didn't do our job as an agency. Because rules are the floor. That's the other problem with some of the lofty language. Rules are a floor, not a ceiling. Rules are for people who don't follow the rules, right? And the A+ players will never come anywhere near this. This is the bare minimum for public safety. So I should have said that at the beginning, but I didn't. So
you said it before, and it makes total sense.
I know, and I have to, because people who are on boards are generally the go-getters. Again, the A+ players. They put their time in to protect the public. They give up billable hours to help us. It's really hard to imagine. We've had rules where people that got up on cases and they were like, well, you don't say anything about I shouldn't defraud my clients. You show me. Where's it say in the rules I can't steal from my clients? And oh my God, it wasn't there because it didn't occur to us to ever have to say, don't steal from your clients, right? So that's why I have to kind of keep bringing us back to what hat we're wearing and what the goals are with this. So this gives me a terrific start. Did I miss anything? Because what I can do is I can start putting kind of the rack together, and I might have to, I apologize, when the weather gets nicer after the rack, I would bring the recommendations back to you guys. We might have to have a special meeting just to address that. And we could say, okay, based on the rack, this is what they came up with. And you would decide if you want to move forward with proposed rules. And then we would enter the rulemaking process. Speaking of which, if I can do a little addendum, the the provisional interventionist license that Bob spoke about earlier, just in case you're on the interested party list, the bill that created that provisional license didn't allow us to act until September 25th, and it had to be up and running on October 1st because 5 days is plenty. So I had to do a temporary rule to put that into effect. You're probably going to be getting emails, gov delivery things. I am now starting the permanent rulemaking process for that bill. So going into public comment, you're going to see these things. If it looks familiar to you, it's because it is. It's just taking the full amount of time to make that rule permanent. So since we're talking about rules, but I'll get this going. I will send out some invitations for the rack. If you think of anything else sooner rather than later, let me know about, hey, I was in the shower and using conditioner and thought about this group, because it happens. Please send that to me. I appreciate all your help. We'll probably have to call a meeting together to look at proposed rules. So did I get everything? I think I did. Okay. Well, unless hey, you're all tired of listening to me, so I'm going to hand this back over to Bob to see if we have anybody on the public phone line who would like to make a comment. Okay. Bob?
Thank you, Ann.
No problem.
Okay, so Chair, if you're ready, you should have a script for public and interested parties feedback.
Yes. Are you ready?
Yes.
At this time, the Behavior Analysis Regulatory Board will hear public or interested parties' feedback. Members of the public, please wait until you have been recognized. Once recognized, please state your name and affiliation to the board for the record.
And for those in the public that are interested, if you haven't already, please send Carrie Edwards an email. And first on the list, because they have their hand up, is Nicole M.
Hi there, my name is Nicole McEwen. I am a BCBA and licensed LBA. I was wondering if we can get some clarification on the notice put out by the Oregon Health Authority on January 12th regarding concurrent billing for 97153 and 97155. It appears as though the OHA has put something out noting that we can only concurrently bill for four units or 1 hour. And it doesn't really clarify if this is per day, per session. I just am hoping that we could get some clarification on billing those codes.
HLO and this board, I'm sorry to tell you, don't have anything to do with the codes and the billing. That's a different division in OHA. We can certainly look for where you need to take your questions, but I don't have anything at this time. And I don't, and again, it's out of our wheelhouse.
Okay.
Sorry about that.
Yes. All right. So it is put out by the Oregon Health Authority. Is there, I don't know, Donnie Jardine, maybe Jardine is the one who put it out. And I did send an email to this individual, but I have not heard a response. Is there just a better place to get clarification on this one?
The other question, the only question I have from you, Nicole, is do you recall what division that came from?
Yes. So I have the notice here. It's Oregon Health Systems Division, Tina Kotek, Governor.
System division.
Medicaid Behavioral Health Manager, Medicaid Programs.
That's it.
It does also give an email, dmap.providerservices@OHA, which I emailed them as well, but I just have not received any response.
The division.
Okay. Yeah. I'm sorry. Yeah. You might want to reach out to the division and call.
All right.
Okay. Yeah, leave your email out there, maybe send a follow-up, but yeah, I'd definitely try calling.
All right. Okay. I will do so.
Okay, thank you.
Thanks.
Was there any other public members that wish to speak? All right. Seeing none at this time. The next on the agenda is other board business, Chair. Code.
I don't see a script for that.
No, we don't
I
have to
suppose
read
I
it.
read something.
We're not reading
Okay.
into it. It's just, sorry. Yeah, it's just the next item number 8 on the agenda. And then I forget which board member might have mentioned it. Adoption of code. That's what I wrote down, but I don't recall. Was it Brenna that brought that up?
Yeah, I mean, I guess we have to decide what to do with respect to that 2022 ethical code, right?
Yes, there was some discussion. The board, just for background, the board has adopted the 2022 credential for the purposes of licensing from the BACB. And there was some discussion about looking at the updated code provided by the BACB. What do you want to do as far as next steps in that space?
So this is Brenna again. I think that as I think Anne should reach out to the BACB, share the DOJ's red line version, and tell them that this is what we intend to adopt, subject to their, but we'd be interested in their input to see what they say.
Okay, so what I would do is I would share that document with the BACB, tell them the board, and I want to hear from the other board members as well. The intent is that you want to adopt the redlined version and you would like their feedback. Is everyone interested in that pathway? Or I think there's several ways we could go with that particular code. Okay, see what they say. What else? Everybody else okay with that as the next step, which is me sharing that code version of the code, the red line version, and tell them that our intent is to adopt it and what their feedback is.
This is McMahon. I agree with that idea. I'm not hopeful, but that would be my first suggestion.
Okay.
This is Jennifer White. I also agree with that suggestion. Another thing I was wondering though is if there was anyone who could reach out to other states to see what they have done in this situation. Just wondering what the response, if other states have done this or just adopted the code in whole, and what how the BACB has responded to them.
Okay, just to let you know, I did some research as part of some other work, and there's not a lot of clear direction in this area. Some states have, I think it was Nevada, they have behavior analysts under the Board of Psychology, and Nevada likes to do their own stuff. Like they come up with their own exams, they come up with everything. So I didn't see much in that area, but I'd be happy to cruise the boards again and see what comes up.
This is Megan, and I believe there's only a couple states that even licensure their behavior interventionists. Isn't that true?
Oh, yes, but we were talking, if I understood correctly, we were talking about the code for analysts and assistant behavior analysts, because they're the ones that are currently licensed through us and beholden to the 2016 code that we adopted. Until 2421 came along this last session, there is no requirement that interventionists follow anything. We cannot put ethics, methods, and that's why this rule that we were talking about is so new, because this is the first time the idea of professional methods and procedures have been extended into this registration type. But we were talking the code, if we go that way, because currently behavior analysts and assistant behavior analysts are beholden to the 2016 BCBA code, as well as 676, 612, and the professional requirements from our statutes. So does that clarify it for you?
Thank you.
Sure. So Jennifer wants me to look and see what other states have done in reference to the 2022 BCBA code, and see if there's any information out there about how they handled it, what they did. And again, every state's different. Every state has different flavors when it comes to jurisdiction and what their constitution allows and all of those authorities. So it's kind of hard to get a baseline comparison, but I can look around. Is there anything else in other board business? So I have some direction on that. I have some direction on the Rules Advisory Committee. Is there any legislation is about to open? I haven't heard of anything on the grapevine that might affect your board, but we will certainly keep our ear to the ground for any changes. Anything else? Well, Megan, I guess you could read us out.
Great. The Behavior Analysis Regulatory Board meeting is adjourned at 11:47 a.m.
Thanks, everyone.
Thanks, everybody.